Before I entered the room, I would check the electronic health record for any new labs or needed labs. I would check for any prescriptions or any orders or medication orders. And then I also would check for any flags or red markers before I entered. And then I would knock on the patient's door. I would perform hand hygiene. Hello, my name is Tina, and I'm going to be your nurse today. Hello, what is your name and your date of birth?
Maria Ryman, 05/06/2005.
I'm going to check the patient wristband to confirm. Okay, confirm. And what brings you in today?
I hurt my right knee.
What makes the pain in your right knee feel better, and what makes the pain feel worse?
It feels better when I'm off of it, and it feels worse when I'm putting weight on it, like when I'm standing.
Okay, and what is the quality of your pain? Is it sharp, stabbing?
It's pretty sharp and it's consistent, and then when I stand up, it's more sharp.
Okay, and what is the region of your pain? Where does it hurt? You said your
It's
right
like
knee?
my right knee, lower below my kneecap.
Okay, and then can you rate your pain on a scale of 1 to 10?
It's about a 4 right now.
Okay, and when did this pain start?
It started last night around 9 p.m. when I was doing basketball.
Okay, and next we're going to move on to the general and neuro. Our patient appears alert, and who are you?
Maria Ryman.
Where are you?
I'm at the clinic.
What is today's date?
December 13th, 2005.
Our patient is oriented to
2025, sorry.
2025. Our patient is oriented to person, place, and time. And then there's no ptosis, no facial droop. Are you able to swallow?
Mm-hmm.
Our patient is able to swallow. I'm going to check her pupil dilations for direct and consensual. Okay, pupil dilation is direct and consensual. If our patient was not alert, I would use the Glasgow Coma Scale. Her speech patterns are good. There is good articulation. It is clear. Her hearing is good. She's able to respond to what I'm saying. Her body position is relaxed. Her face is relaxed. Her overall skin temperature is warm, and her moisture is warm. Her color of her skin is tan with pink undertones. Can you please squeeze my hands? Can you push on my hands? Pull on my hands? Can you push up on my hands? Push down on my hands? And then can you please lift both your feet up like this? Okay, perfect. Her muscle strength appears good, +5. And then can you please move your fingers and your toes for me? Are you experiencing any numbness in your fingers or your toes? Okay, and then overall personal hygiene is good. There's no extra body odors. She appears to be keeping well up to do with her hair. Next, we're going to move on to vital signs. So first, we're going to get your temporal artery thermometer and get her vitals. It's at a 98.7. Next, we're going to listen to the apex of your heart for 1 full minute. Can you please lay down for me? Okay. Starting at 6. Okay, her rate is at a 76 and her regularity is regular. There's no irregular heartbeat. And then next we're gonna have you sit up and assess your breathing. Okay. Yeah. Okay, our patient had about 8 breaths per minute, or 16 breaths per minute, 8 breaths for 30 seconds, and it is unlabored. She doesn't using any extra muscles to help with her breathing. So next we're gonna get your pulse oximeter. Can I please have your pointer finger? Pulse ox is at a 99. And then next we're going to get your blood pressure. So first we're going to estimate or check for correct sizing, make sure it's not. Okay, this sizing is good. We're going to bring this around. It is snugly fit. Okay, and then we're going to have you place your arm from here. We can get you your and we will estimate the systolic. Okay, estimated systolic was at about a 110 was when I stopped feeling the radial or the pulse. And now we are going to get her blood pressure. Okay. Are you doing okay?
Yes.
Okay. 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 Her estimated blood pressure is about a 106/80. All right. Next, we'll move on to respiratory. If our patient had any oxygen masks or nasal cannulas or anything to help her breathe, I would check for the fitting and make sure that there was no redness around where they were and that the flow and the rate was proper. Have you had a cough recently?
No.
Do you have any mucus coming up?
No.
Okay, if there was mucus, I would check for the consistency and the color of it. And then now we're going to auscultate and listen to 6 areas. We're going to auscultate for the 6 areas on the front and 8 areas on the back and check for if it's clear, if there's any adventitious sounds. Okay, anytime I move my stethoscope, can you please deep breathe in and out?
Can I lean back?
Hmm?
Can I lean back?
Yes. Actually, can you sit up? No, get right like that, perfect. Appears clear. Appears clear. And then listen right here. Okay, clear. There's no adventitious sounds. Okay. Okay. Appears clear. Now I'm gonna have you turn this way. Or can you come sit on the back right here? Maybe put your feet right there. Yeah. And then we'll auscultate to 8 areas on the back. Anytime I move my stethoscope, can you please breathe in and out? Clear. 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 Good. Okay, and all 8 areas on the back are clear and there are no extra sounds. If the physician ordered any deep breathing exercises or the use of a spirometer, I would give client education. Next we have the cardiothoracic, so I'm going to listen to the 5 areas on the heart starting with the aortic, pulmonic, Erb's point, tricuspid, and mitral, and then assess the regularity of those. So, can you please lay down for me? And then I'm going to listen to the first aortic, pulmonic, Erb's point, and then tricuspid. Okay. All 5 sounds are regular, and so that was first with the diaphragm, and next I'm going to listen to those all with my bell of my stethoscope. First the aortic, pulmonic, Erb's point, tricuspid, and then mitral. Okay. And then all of those, all sounds are present and regular. And then next we're gonna have you sit up. I'm going to sit up, and then I'm going to check, for one, S1 is heard best at the apex of the heart, S2 is heard best at the base, and then there was no other additional sounds like the S3 or the S4, and it was regular. And then next we're gonna check capillary refill. There's good capillary refill within 3 seconds. I'm gonna do both feet. Okay, good capillary refill. And then next, I'm also gonna check for edema. There's no pitting edema on there. And then I'm also gonna check right here, bilaterally. And then also here and here. Okay. There is no edema. And then now I'm going to palpate the radial pulses bilaterally, check for rate and regularity. Okay, 2+ for those, and then I'm going to palpate the right in between here, so right there and then right there for the posterior tibial. And then I'm going to do the dorsalis pedis pulses. Okay, 2+ for those and 2+ for those. Okay, next I would check for any IVs and make sure that the flow and the rate was proper and what the physician had ordered. And then I would also check for the use of any SCDs, TED hose, or foot pumps that would help our patient prevent deep vein thrombosis. Next is skin. So we're going to assess the overall skin integrity. We're going to check for, the overall skin integrity is good. There's no lesions, there's no drainage, there's no area of redness, there's no dressings, there's nothing that is of concern. We're also going to assess skin temperature. Our patient is, I'm going to pull these up to assess skin temperature. Our patient is warm bilaterally. And then I'm going to assess skin turgor. Okay, there is no tenting. Skin turgor appears good. I would use the Braden scale to assess for skin breakdown and the risk of developing pressure injuries. If our patient, if our patient was on bed rest, I would check the heading of the bed and implement a turn scale. And then I would also use, if our patient was using any pressure reducing things like air beds or water beds, I would make sure that those were working properly. And then next we have abdomen. So can you please lay down? I'm gonna first check to see if her abdomen is distended. Do you mind if I pull this up?
No.
You don't mind?
I don't mind. I allow it. Okay,
so our patient's abdomen is flat and not distended. And then we're going to auscultate and listen to all 4 areas, starting in the right lower quadrant. So I'm going to pull this down. Okay, vowel sounds are present in all 4 quadrants. And then next I'm going to palpate and just check for any rape tenderness, distension, any masses. Okay, her abdomen appears good. I would also look for any IVs, ostomies, anything that would be of concern on her abdomen. I would check and make sure that there was no redness around them, and there was any fluids or anything coming out or drainages. All right, can you please sit up? And then, are you nauseous right now?
No.
Are you tolerating your diet well?
Yes.
Do you need to implement any changes to your diet?
No.
Okay, and then when was your last bowel movement?
12 p.m. today.
And was it consistent and good?
Yes.
Okay, I would also, I would use the Bristol stool scale to assess her bowel, or her bowel movement. And then next we have urinary. When was the last time that you peed?
12 p.m. today.
What was the color of your pee?
Clear.
Was it, it wasn't cloudy?
No.
Did it smell?
No.
Was your urination painful?
No.
Okay, and then if needed, I would use a bladder scan if there was to assess for any urinary retention. Next is mobility. Do you use any mobility assistance devices such as a cane, walker?
No.
Okay, and I would use the standardized scale to assess fall risk, or the Morse scale to assess her risks of fall. And then before I left, I would make sure that the bed was in a low locked position, the alarms were set properly, and the patient's call light is in reach. Thank you so much for participating in my assessment today. It was a pleasure. And are you in a comfortable position?
Yes.
Okay, I would perform hand hygiene on my way out, and I would leave the door.